I am Dr. Rashmi Sharma, a consultant breast surgical oncologist at Bagchi Shankara Cancer Hospital and Research Institute. Today I will be discussing the role of surgery in breast cancer. Breast cancer, as you know, is a disease which is curable if is diagnosed early. So surgery has a role in diagnosing breast cancer because we first have to do a biopsy. Sometimes, usually we are doing a needle biopsy, but sometimes we have to do a surgical biopsy. There also there is a role of surgery. Once the patient is diagnosed to have breast cancer, the primary role comes for the surgeon to do the surgery if it has not spread anywhere else. In that case, we either do a mastectomy or we do a breast-conserving surgery. In mastectomy, we usually remove the whole breast along with some tissue from the axilla also. In breast-conserving surgery, usually we remove the breast lump along with some normal tissue around it. This is the breast surgery we do, but with breast conservation surgery, we have to have breast radiation also. This should be kept in mind if anybody opts for a breast conserving surgery, because breast conservative treatment involves breast conserving surgery plus radiation. This has to be remembered, and radiation cannot be omitted if you are going for breast conservation. Secondly comes the role of axillary surgery in breast cancer. This is also important that we have to do axillary surgery. This can happen in different forms. There is something called a sentinel lymph node biopsy. If somebody comes in early stage of breast cancer, that is stage 1 or 2, and there are no clinically palpable axillary lymph nodes, then we do a sentinel lymph node biopsy, in which after giving a dye, we remove about 3 to 5 nodes and send them for frozen section. If they are found to be negative, then we don't do anything else. If we find that the sentinel lymph nodes are positive, then sometimes we have to go and proceed with the axillary lymph node dissection. This is sentinel lymph node biopsy. Sometimes when the breast cancer has already spread to the axilla, that is clinically the axillary lymph nodes are palpable, or on ultrasound they are enlarged or abnormal, then we have to do an axillary lymph node dissection. In this, all the lymph nodes in the axilla below the axillary vein are removed. This happens in which level 1 to 3 lymph nodes can be removed and they are sent for biopsy. The future treatment for breast cancer, which is radiation and chemotherapy, depends on how many lymph nodes are positive in the axillary lymph node specimen. So axillary lymph nodes are helping us in decide what the adjuvant treatment is going to be, and they also help us in staging the breast cancer. It is an important part of treatment of breast cancer, and only under the guidance of an oncologist can you omit an axillary lymph node dissection or a sentinel lymph node biopsy.